Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752 right here in the studio. And when you phone, you get a free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. And again, the number to get your free book, 866-870-5752. Would you like to talk to David?
It looks like we have two Davids in a row.
Two Davids. Okay, first we're going to do the hip, then we're going to do the knee. So,
okay,
David in
good.
Covina, you hang on. We'll get to you next. So we're going to David in North Hollywood.
David, Dr. Marc Darrow, how are you today?
David, are you there?
Let's put him on hold and go to the other David, and then we'll get back to him.
Good idea. Let's go to David in Covina.
David, it's still Dr. Marc Darrow. Can you hear us?
This is David in Covina.
Yes.
Yeah. Your knee bothers you.
A little confused. My wife was listening to you, and she said, David, call him right now. So I'm trying to find out what this is about. But I tore my meniscus a few years ago. I was too busy to go work out, so I thought I'd just do it with the home video, which turned out to be a mistake. After the meniscus surgery, the physical therapist on multiple occasions would say, man, he sure took a lot out of there. Everything was fine for, I don't know, maybe a couple of years, and then I've been having trouble with the knee since.
Okay.
And so wondering what possibilities there are for me.
Well, again, like I always tell people, I have to examine you first. I can tell you generalities. I treat people with meniscal tears all day long. It's one of the most common things that we see. And I think I do more knees than anything else, although I do the whole body. I do everything from the head all the way down the back, every joint on the way down to the feet. So there's nothing that I really don't do. But knees are probably the most common, and I've always heard this growing up, your knees are the first thing to go. And I think it probably is kind of true for the average person. So I am sorry you had that knee surgery, and I'm not going to put down your doctor because it is the culture of orthopedics to take out meniscal tissue if there's a tear. But I do it the other way around. I rebuild the tissue to rejuvenate it by growing back the cartilage and the fibrocartilage. So the meniscus is like a pancake between the bones. It's the cushion. Mm-hmm. And to take it out, to me, means you have immediate arthritis. So I hear orthopedic surgeons tell my patients all the time, if you don't get this surgery, you're going to end up with arthritis. Well, I can't say BS on the radio, can I? No. But that's what I call it. Because after the surgery, that's immediate arthritis. You don't have to wait to get it. So I'm just saying it the way it is. I am against these surgeries. If you don't like the way I speak about it, or people don't like it, I tell them to go to a surgeon. It's fine with me. They can do that. But it's not a really great procedure to do in my book. I'm just one guy. I'm not telling people what they should do. When people say, what should I do? I go, I'll educate you. But then you're going to decide. I don't ever want a patient pointing his finger at me saying, you told me to do this and it didn't work out. And I never give guarantees of my work. I try to be as honest as I can. And honestly, I don't think surgery is a good thing for people unless it's either an emergency, then go get a surgery. You have a broken bone sticking out, something like that. You better get a surgery right away. I'll tell you what happened to me. I was in a car accident a few years ago. My face got really smashed up, and I was taken to the hospital, to the emergency room. And The doctor wanted to operate. It was close to midnight, and the doctor wanted to operate on me with the wrong tools. He didn't have the right kit. He needed some little micro tools, and he didn't have them. And after me waiting for the right kit to show up, he said, "We can't get it. I'm just going to operate anyway." And I go, "No, you're not." And he said, "If you go home, you're going to be infected by the morning." And I said, "I'll take my chances." And I waited, because that's how I am. I'm going to do it the way that I think works. And I waited till the morning, and then I went to my own surgeon, who I know very well, who's upstairs in my building, and I had him do it the right way. So that was a surgery that needed to be done. You know, my face was torn apart. But knees, shoulders, elbows, fingers, all that stuff, no way. I don't like that. I just don't like it. I have seen bad results for many, 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 many years. I was on the path to do orthopedic surgery. I love doing it. And after I had a shoulder surgery by my boss that, I don't know how to say it, it ruined my shoulder for many years until I learned about injections of regenerative medicine, which I did on myself, and I was healed the next morning. That changed my life. It changed my life path from thinking surgery was the way to thinking doing conservative, natural things are the way. And I don't mean to be hard-headed about this. It's just that I am. It's just what I've seen. And I like surgeons. I just don't like these surgeries, if that makes sense. I really do like the surgeons. Honestly, their work is the hardest work in medicine. The risks are so high. Alan called before about do stem cells or platelets cause infections? Well, I've never had one in 25 years of doing regenerative medicine, but I see a lot of infections from surgeries. So I don't mean to bash the surgeons, because I am not. I love having surgeons available. They do the hardest work in medicine. There's no question about it. But I don't think our culture of doing surgery for these minor tears and things like that is a good thing for anybody. And your story
so, Doctor, this is the wife who told David to call.
Hi, wife. What's your name? What's your name?
Denise. Another D. Denise.
Oh, Denise. Nice to meet you.
You too. So, do you think it would be advisable? Is it worth his while post-surgery on that meniscus for him to come in? Do you help?
Do you have a rope? Do you have a rope at home? Because it sounds to me like you're going to have to put it around his neck and drag him in.
Oh, well, I'm just wondering, post-surgery, post-meniscus surgery.
Yes, I treat post-meniscus surgeries all day long, every day.
Oh, good. Okay.
It's not uncommon. It's not uncommon at all.
Even though it was a bad idea to have it in the first place, there is help.
Well, I don't know if I can help him. You know, I don't promise anybody anything, but I'm happy to look at him and see what's going on. I can tell you this. Okay. This is all I can tell you. I treat tons of people who have had meniscal surgeries, rotator cuff surgeries, back surgeries, you name it, surgeries all over the body where the surgeries have failed. The people are unhappy, and then they come to see me, and then we can get them better. Not everybody. I can't get everybody better, but at least it's not something invasive. It's conservative. All you do is you come in and get some injections. It's easy. You walk in and walk out. You drive there and you drive home.
Okay. I like the sound of that.
All right, Denise, you grab him and drag him in. By the way, the number to the office, if you want to call there now, either to make an appointment or find out more information, is 800-300-9300. That's to the office, 800-300-9300. And for you folks who want to watch me doing these procedures on videos and read all about it and get the science and look at the studies that I've personally done on it, go to my website, www.lastemcells.com. That's www.lastemcells.com. And Denise, because you called in, we're going to send you a free copy of my book. It's a $25 book. It goes to you for free. We're going to mail it out for free. It's called Stem Cell and Platelet Therapy, Regenerate, don't operate. So my medical life has been dedicated to keeping people from having surgery. And I think I've done a great job with that. And I'm not patting myself on the back that I'm better than anybody else. But honestly, I love what I do. People say, why don't you take vacations? Well, because I would rather be there with patients, helping them heal, than being out somewhere away from them. I care for my patients. Every one of my patients gets my cell number. That's unheard of. They get my email, my personal email. I'm getting pinged all day long by patients about what's going on with them. I want to know. I don't feel like I can help my patients, unless they're in constant contact with me. And I tell them, I laugh and I say, if you don't get a hold of me and let me know what's going on, I'm going to be mad at you. So,
well, I've been listening to you off and on over the years when I happen to be driving at the right time on Saturdays.
Yeah.
And I wrote all your information down today.
Wonderful.
As I pulled into the driveway before I walked into the house, I got all your numbers and your website.
I know, and you grabbed your husband and said, call him now.
And I walked in the door and said, call this guy now. He's on the radio now.
Anyway, all I can tell you is the probability is very high that I can help your husband's knee.
Well, we'll see what we can do to get him over there to West L.A.
All right. Tell him.
And my husband is looking at your reviews on Facebook right this minute, and he says they look good.
Well, there's some bad ones too. Not everybody loves me.
Oh dear. Well, he hasn't seen those.
He will.
Okay. Well, thank you so much for taking our call right away.
So, David, if you like tequila, I have some at the office.
You have some what?
I have some tequila at the office.
That's quite all right. I'll pass.
Actually, there was a guy who came in. There was a gentleman who came in who was a little nervous about getting an injection, and I said, "I've got tequila." I said, "I have a bottle of tequila someone gave me. It's in the fridge." He goes, "Please give me a shot of tequila. It'll help me a lot." And I said, "I can only do that. I can only do that if your wife is driving home." He goes, "She'll drive." So I gave him a shot of tequila, and he was like, "Go ahead and inject me. I feel great now."
Yeah, well, I was in chemical recreation in high school. I've pretty much given up since then.
Yeah, I agree with you. I don't drink either. At any rate, thank you so much, David, for calling in. And Denise, thank you for asking your husband to do that. And God bless you both.
Thank you for being there.
And honestly, David, I think there is a great possibility for you to heal. I just have to examine you.
Into it.
Yeah. All right. God bless you.
Thank you. Our number is 866-870-5752 for you to get your free book, Dr. Darrow's latest Stem Cell and Platelet Therapy, 866-870-5752. And we'll go to Carlos.
Hey, Carlos, Dr. Marc Darrow, your friend has arthritis, and he can barely walk. Is that his knee, foot, ankle? What is it?
I was calling for another person I met at church this morning. And she, when I saw her a couple of days ago at church, she came in with a cane, and she could barely walk. And she said, "It's my arthritis in my knee." So after leaving church, she went to the doctor, and they gave her a shot on the knee. When I saw her this morning at church, she was walking, but without the cane, but still, it was, she felt better than she did the other day. And I wanted to order this book for her. That's what I called.
Wonderful. So let me explain what happened to your friend. The good news is she feels better, right? She's walking without the cane. The bad news...
That's what she said this morning.
Yeah, the bad news is that the doctor probably gave her a steroid shot. We call those cortisone.
I don't know what she didn't say what kind of shot she got.
Well, that's probably what happened.
She didn't say what kind she got, but I imagine that's what you just indicated.
Yeah. So what that does is it dissolves away the cartilage. So that's not something I like to give anybody. It sounds like it's great because you get...
Like I explained to the lady that answered the question, she's in her late 80s. So, I just happened to catch your radio program by chance, and I heard you guys mention about the book. I said, well, maybe that would, after I give it to her, if I could get it for her, brother, she could just, maybe give you a call, maybe.
I would love to hear from her. Carlos, how's your body doing? Do you have pain?
I'm doing fine.
Good.
So far, thank God.
Yeah, thank God. So I'm going to talk a little bit about your friend and what happened to her. So it seemed like it was a great thing because her pain is less, and that is traditional medicine. Get rid of the pain right away. Don't care if you screw up that knee later on. And what that does, that steroid, especially on a weight-bearing joint like a knee, is it dissolves away some of the cartilage and causes arthritis. So why would a doctor want to do that? I don't know. That's not something I do. I do something natural that actually regrows the cartilage and helps get rid of the arthritis. It's the opposite. Now, albeit my treatment generally is not going to get rid of the pain instantly because tissue takes a while to grow back. But for me, I'd rather be patient and do something that is natural and helps the body rather than feels good and hurts the body. It's like it's the statement of you can win the battle, but then you're going to lose the war. What's the point of that? That doesn't make any sense to me. How about you, Nita?
Yeah, it doesn't make sense either. Why take tissue out when you can regrow tissue?
And why destroy it? I had a woman talk about it on the show all the time. She was a tennis player, and she had 16 steroid shots, cortisone shots, in her right elbow to get rid of tennis elbow. That dissolved away that extensor tendon. That took me quite a bit of time to get that to grow back for her. All right, so I'm going to take other questions. Carlos, your call got dropped. I'm sorry about that, but we do have the information. I don't know if you were listening to it. We don't need to speak to you anymore today. And we're going to go on to a question right here. Let me see if I can find. Actually, you know what we're going to do, Nita? It's your time to be the star.
Oh, boy. I can't wait.
Yeah. So, Nita, how do you impress a baker?
Bring fresh made chocolate.
No, but you're kind of on the track. You bring the baker flowers.
Oh, that's a good one. That's a good one.
But you know what? You didn't really laugh enough, so I'm going to have to hit you again.
Okay.
How does a rancher keep track of his cattle?
Not QuickBooks.
Nope. A calculator. There you go. Once I get you to laugh, I can let you off the hook.
Okay, that's good.
You lucky woman.
Okay. So do you have a cure for my allergies?
Of course.
Great.
Yeah, of course. I have a cure for everything.
That's awesome. So if you want to join this conversation...
Allergies, by the way, allergies that people have are usually food-induced. They can be other things, but, to get allergies to resolve, you get off of any kind of grain, dairy, red meat, and you go to an alkaline diet. Alkaline diet heals just about everything, but people don't like doing it, so it's a problem.
But I just cooked a tri-tip last night.
Well, then I would eat that and give me some, too.
So if you want to join this conversation and you might have pain, 866-870-5752 right here in the studio is our number. You can speak with Dr. Darrow and get your free book right now, which is Stem Cell and Platelet Therapy. Regenerate, Don't Operate is the byline. It has 264 scientific studies, and the foreword is written by Suzanne Summers, and you appear in her book, as you said a while ago. It's quite a chapter. It's actually about 14 or 15 pages that she wrote about you.
This is an amazing woman. Suzanne Summers, we really love you. Us doctors who do what is called, improperly called, alternative medicine. We do the natural medicine. It's traditional medicine. To me, that's the problem. You know what? If you're dying and you need to go to the hospital, traditional medicine's great. But if you're just the average guy that's got pain or some issues, traditional medicine doesn't really have the answers. I'm sorry. I wish it did. I don't want to get medicated. Do you, Nita?
No.
Wouldn't you rather just change your diet and heal your allergies that way?
And take a few vitamins, call it a day. Yes, absolutely. You have been listening to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens. I want to thank Alex and Suzette for being behind the scenes and everybody else here at Living Pain-Free. And remember to listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens. I thank you for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.